Do not worry about the fact that you feel you're somewhat overweight. You're actually healthy here. The alternative is being thinner, but also hugely incapacitated.
Michael White has been living with long COVID for over a year, and he says it has upended his life. And as he runs out of money, he says there needs to be more specific financial assistance for those with the post-viral condition, a range of symptoms affecting some people months after recovering from a COVID-19 infection.
I feel as though the government assistance programs have not evolved to accommodate people like me with long COVID who have no way of knowing when or if they're going to make a complete recovery.
White says he was living a very active life, working full-time in marketing, freelance journalism, and managing a food blog with his partner. After getting long COVID, White says he had to take medical leave in the spring, and now he says he feels exhausted after a couple of hours of activity. He says it reactivated a condition that flares up his immune and digestive system, and a movement disorder that can cause painful muscle spasms, which he can keep under control by doing this with his fingers.
Well, certainly I was capable of international travel back then. You can see that I weighed a lot more here, 35 pounds more. And also I'm sitting in a place where I could eat or drink anything I wanted without hesitation or concern.
White ran out of federal EI sickness benefits, which max out at 26 weeks. Then after being laid off in October, he tried to get regular EI benefits.
I didn't qualify because I made the mistake of being honest to the government and telling them that I was only capable of searching for part-time work.
A federal press secretary told City News if a person needs more than 26 weeks of sickness benefits, they may qualify for disability benefits, but long COVID isn't explicitly named as a recognized disability. Speaking at a press conference in Vancouver on Tuesday, Health Minister Adrian Dix couldn't immediately speak to how disability benefits work for people with long COVID, but the number of patients referred to BC's post-COVID care network has been going down.
But if you're having it, if you're living it, if you're dealing with it, it continues to be a challenge. We standardize our care pathways, and I think across the province are providing a strong healthcare response.
In a statement, BC's Ministry of Social Development and Poverty Reduction says long-term COVID patients may be eligible for disability assistance depending on their symptoms if they meet the eligibility criteria. Depending on their financial status, they can also be eligible for income assistance. While White expects to have better chances of recovery compared to other long COVID patients, he says he wishes there was more help for him and others.
I am close to being out of money, and I would like to think that the government would be willing to help me after having been a very responsible tax-paying citizen for 38 years.
In Burnaby, Kier Junos, City News.